Good morning, I'm Dr. Srilekha. Today's topic for discussion is laser in conservative dentistry and endodontics. I would like to start this discussion with a quote. Every time you subtract negativity from your life, you make room for more positive energy. So moving on to our today's topic, laser is an acronym of light amplification by stimulated emission of radiation. W.R. Bennett and Heroet have developed the first laser with helium and neon. C.K.N. Patel produced the first laser with carbon dioxide in 1964. Stern and Sugnas in 1964 began looking at the possible uses of ruby laser in dentistry. The first laser was introduced in the field of medicine and dentistry by Goldman et al. In 1960. A laser is defined as a device that transforms the light of various frequency into a monochromatic radiation in a visible infrared and ultraviolet regions, with all waves in the phases being capable of mobilizing immense heat and power when they are focused to the close range. The basic unit of this radiant energy is photon. And it has the three important aspects that we have to know before. That is the amplitude. The first is the amplitude, which is defined as the vertical height of the wave oscillation from zero axis to its peak. The second property of the wave is wavelength, which is the horizontal distance between any two corresponding points on the wave. As the wave travels, they oscillate several times per second, and this is termed as a frequency. Frequency is inversely proportional to wavelength. The shorter the wavelength, the higher the frequency, and vice versa. So this is a schematic representation which is showing the wavelength, amplitude, frequency, and speed is calculated wavelength into frequency. So what is the properties of laser light is that it is monochromatic, that is emit only one wavelength, coherence, that is all in same phase, improve focusing, polarized in one plane, easy to pass through media, collimated in one direction, non-spreading, high energy, that is intensity measured by watt. So this is the schematic representation showing the different laser components, which includes the laser material surrounded by the energy source or the current, and you have a high reflectance mirror at one end and partially transmissive mirror at the one end, which is collimating and producing the laser light. All these are held within the optical cavity. So what are the types of lasers, which includes the solid state laser, gas laser, liquid laser, and semiconductor laser. Example of solid state is ND arc and ND glass laser. Gas laser includes helium neon laser, carbon dioxide, and argon. Liquid or dye lasers includes polymethylene dye, coumarin dye, and rhodamin laser. Semiconductor includes gallium arsenide laser. So this is the schematic representation which is showing the electromagnetic spectrum. The laser operate in the ultraviolet, visible, and infrared. So laser for application in dentistry, which includes a soft tissue laser, which example is carbon dioxide and diode laser, which is used for soft tissue procedures like gingivectomy, freenectomy, flap incision, crown lengthening, and gingival contouring. And hard tissue lasers includes erbium lasers, which includes the hard tissue ablation, cutting resin fillings, caries tooth removal. Non-surgical or diagnostic lasers, which includes the argon lasers and diagnodent is an example. Caries and calculus detection, composite curing, CAD-CAM optical impression, and photo disinfection laser, which comes into this category. So this is a table which is showing the gas laser, diode laser, and solid state lasers with the wavelength. Gas lasers, example is carbon dioxide, the wavelength is 1600 nanometer. And diode lasers, the nanometer example is arsenide, gallium arsenide phosphide laser. The nanometer range is 655 to 810 and 960. Solid state lasers, which includes neodymium doped yttrium aluminum garnet laser, the wavelength is 1064. And erbium laser, where the wavelength is 20940. So this is a representation which is showing the laser type with the wavelength, application, power, energy, and output. Where you have the near UV ray laser is used for bleaching purposes, and diode laser is used for diagnosing caries, and ND arc laser is used for etching the teeth, and you have erbium laser which is used for tooth cutting procedures, CAD-CAM, pulpotomy, and etching. Erbium YAG lasers is used for tooth ablation or tooth cutting procedures, and carbon dioxide lasers is used for soft tissue ablation, etching, and caries inhibition. So use of lasers in conservative dentistry. Here is the schematic representation showing the use of lasers in conservative dentistry, which includes the lasers are used in tooth bleaching procedures, dentin hypersensitivity management, caries tooth removal, indirect restoration for the deduction of caries, composite curing, and CAD/CAM in optical impression. So for caries diagnosis, the example is the Diagnodent, which is used for caries and calculus detection. The nanometer wavelength that is used is 655 nanometer. So the Diagnodent scale operates, it has a scale which has a display. The display shows 0 to 10 and 11 to 99. 0 to 10 is the healthy tooth structure and 11 to 99 is caries. So what is the Diagnodent? It uses a red light which operates at a wavelength of 655 nanometer, where the porphyrins is the agents that is present in the caries which increase the fluorescence. So how the laser is also used for caries tooth removal. Caries tooth removal, it is called as hydrokinetic cavity preparation. So the laser is directed at the roten area or the caries area, which contains more water molecules than the rest of the tooth. The water molecules in the decay heated rapidly and the pressure increases, which explodes with a popping sound. The laser kills any bacteria in the area and the tooth is sterilized. Laser assisted cavity preparation and conventional cavity preparation difference is that laser cavity preparation takes lot of time, but the main advantage is that it disinfects the area and removes the smear layer, while conventional cavity preparation take a lesser time, but it provides a smooth edges and produces a smear layer. So these are the advantages and disadvantages between the laser and the conventional cavity preparation. So laser is also used for acid etching the tooth surfaces for composite restoration. The main laser that is used for etching purposes is erbium laser or ER-YAG lasers. And it is also used for curing the composite. The laser that is used for composite curing is that argon laser, which operates at the light at the wavelength of 488 nanometer, which is a blue light. So laser scanning, that is the optical impression which is used in CAD/CAM technology for detection of the occlusal and the bite forces and for the bite registration procedure. So this is a representation of the laser scanning of the CAD/CAM devices. So the lasers is also used for prevention of dental laser. Example, the argon lasers and diode lasers is used for killing the bacteria and for minimizing the occurrence of the caries. So desensitization, the lasers is also used for dentin hypersensitivity management, where we use the diode lasers, mainly the carbon dioxide lasers, or we can also use gallium aluminum arsenide lasers. The main mechanism of action of these lasers is that they alter the electrical conductivity or the activity in the pulp nerve cells to make them less sensitive to the pain. Carbon dioxide lasers have thought to occlude the dentinal tubules, thereby reducing the dentin sensitivity. And lasers is also used for removal of the old restorative materials. Okay, like erbium lasers, hard tissue lasers are used for, which is used for cavity preparation and for cavity etching. The same laser is used for removal of the older restoration too. So what is the use of laser in endodontics? It is used for analgesia. That is, in analgesia, the Nd:YAG laser, neodymium yttrium aluminum garnet laser, is vastly used for analgesia or to relieve the tooth pain in endodontics. The wavelength of this laser interferes with the sodium pump mechanism, leading to the change in the permeability of the cell membrane. Laser is used for pulp vitality assessment. Example, laser Doppler flowmetry, which is a non-invasive method to assess and measure the rate of blood flow within the pulpal tissue. And and for direct and indirect pulp capping amputation. So laser is used for direct pulp capping procedure. The laser that is used is a soft tissue laser, that is the carbon dioxide, which is used for removing the coronal pulp also. So it is used for pulp amputation procedure also. And then in RCT, access cavity preparation, for refinement of access cavity preparation, hard tissue lasers are used, and for during biomechanical preparation, the lasers are used for activation of the irrigant, that is sodium hypochlorite, which is called as PIPS, that is photon-induced photoacoustic streaming, where the sodium hypochlorite is pooled inside the chamber and is activated using the laser in order for the better disinfection procedure. And where finally is the laser assisted obturation, where obturation of the root canals, where the laser can be used for melting the GP and for condensation purpose for obturation. So condensation of GP and better sealing property. And a laser is also used for periapical surgery. The laser that is used is carbon dioxide laser for putting the flap elevation and for flap preparation. And these laser fasten the wound laying, and there will be less bleeding also when we use the laser. And it is also hard tissue laser is used for retrograde cavity preparation. These laser proved to be effective by providing relatively bloodless and much less or no post-operative pain. So laser also reduces the amount of bacteria and other oral pathogens in the surgical field. There is a lesser pain in most cases. Laser application provide good hemostasis with reduced need of suture. So when we use laser, there should be a protective equipment also that a dentist should use. Wavelength of laser emission should be properly managed, and maximum permissible exertion limit it should not exceed. Degradation of the absorbing media or filter, optical density IWay, and then multiple wavelength requirements, restriction of peripheral vision, and comfort and fit. So various hazards encountered in dentistry is that ocular hazard, tissue hazard, respiratory hazard, combustion, fire and explosion can occur, and electrical shock. So to finally conclude, as the dental technology continues to evolve, the new methods of performing certain dental procedure will continue to replace those which were once thought to be pinnacle. When the knowledge of the parameters which are necessary for an ideal treatment is reality, lasers can be developed which can provide the dentist with ability to care for their patients with improved technique and equipment. So this is a discussion about the laser in restorative dentistry and in endodontics. Thank you.